And along with that, what we saw were major increases in the percentage of students being proficient in reading, which is not surprising, and a major decrease in the students that were really struggling with reading over that same time period. Next slide, please. And again, a different format, and I apologize for having a different format on the slide, but this was I wanted to show that these are 5 high schools, a high school in addition to the ones in Kansas City, Kansas, one in Houston, Texas, that use the math strategy that's part of the First Things First framework and show dramatic increases. The yellow is post-intervention and the color is pre-intervention. Dramatic increases over this period in the percentage of students who are showing proficiency in math. So in addition to having kids stick with school longer, we're also having kids show dramatic increases as well in their academic performance. Now that isn't necessarily intuitive, because if you're holding on to more kids toward graduation, you'll tend to be holding on to those kids who would have dropped out, obviously, and those tend to be your lower academic performers. So in some cases, you might expect to see actually a dip in academic performance as you increase graduation rates, but our partners in Kansas City and in Texas showed an increase in academic achievement as well. Next. And now let's go to the actual intervention itself. And the theory of change is here on this slide. Begins with a set of outcomes that we're shooting for, which you've already heard about, and the relationships, teaching and learning, and reallocation of resources. There's a set of strategies that we use, these 4 strategies: data-driven dialogue, instructional improvement, small learning communities, and a family and student advocacy system. And then a set of processes and supports that our organization provides in partnership with the leaderships, such as Mary and the other leaders in the district, to support the teachers and the educators, the students and families to be able to implement these strategies. Next slide. Let me just give you very briefly an example of what each of these reform strategies might look like on the ground. The data-driven dialogue, one of the key elements of that is a more recent development, but one that was begun in Kansas City, Kansas, called Vital Signs, where this is a classroom-based, a combination of student surveys and classroom-based observation that takes, and again, the medical, the medical reference is good here. The idea being that there are some vital signs of what goes on in classrooms that you can observe, and vital signs of what students are telling you about what's going on in their lives at school that can signal and give you direction for the kinds of focus that you should be putting to your professional development resources, as well as the attention of the school too. So we've developed a system that's very user-friendly, high-tech system, but it's very easy to use of vital signs to measure these vital signs of what goes on in classrooms and what goes on in the minds and hearts of students to be able to use in an ongoing way for a school to improve itself. In instructional improvement, we've worked very hard with our partner schools to develop curricula that embed both high quality and high interest material for adolescents, as well as research-based strategies that will generalize from literacy courses to other courses that they can use to master complex material. One of the curricula that we've developed is called Health Matters, which is an introductory curricula around health issues that is used in our small learning communities, but is also used in schools where there are health pathways or health-focused magnet schools. Small learning communities is the structural reform that's part of First Things First. An example of this would be a health sciences community that Mary can tell you more about during the Q&A if somebody would ask her about it. It's very interesting what's going on at Wyandotte High School. But the entire school would be divided up into smaller learning communities that would stay with the young people for all 4 years and would have a theme of the students and the faculty's choice that would be the focus of a 4-year course of study, kind of like a major in college. But that creates both continuity of the relationships between these young people, the families and the students, but also an academic focus for the community. And finally, the family and student advocacy system, which is a way to connect up the folks in the family with the folks in the school. As I spoke earlier about forming relationships that are more long-standing and mutually accountable and mutually respectful, that in order to do that, what we have found is that you have to figure out a way to have people get to know each other. And you can't do that by simply expecting families from all different communities to come to PTA meetings and bake sales. is that you actually have to create an expectation and an opportunity for every adult in the building to get to know the families and as well as the students in a small group. So we create this structure within the small learning communities where each adult takes on 15 to 17 families and students for the entire time they're in the high school and forms the kinds of relationships that can get to some of the issues, such as health issues, that might be barriers to the student's success. Okay, I'm going to wrap it up there. I expect there are a lot of questions. I apologize. It's a bit rapid fire, but I did want to take to the next slide and introduce you to my colleagues, Randy Speck, who I'm not sure if he's on or not, but I know Mary Stewart is, the principal of Wyandotte High School in Kansas City, Kansas, which was our longest-standing partner in the First Things First work now. They're actually into their second decade of work using these strategies that they have completely made their own. And Randy Speck, if he can join us, is one of our more recent partners who's just in their first and second year in their district of implementing First Things First. So I thank you again for the opportunity to share this information with you and look forward to your questions.